So our first speaker is going to be Dr. Jennifer Gill. She is one of our excellent dermatologists and leads our melanoma program in the dermatology clinic. She's a physician scientist with years of expertise in the research of melanoma and its metabolism. So without further ado, to introduce Dr. Gill.
Good morning, everyone. Thank you so much for joining us. Today, I'm going to be talking to you about what I consider your action plan for melanoma and a checklist of things to do from your dermatologist. So first of all, I want to start by welcoming you, but also congratulating you. It's very challenging when there's so many things in our health and with our lives that are out of our control, but really educating yourself and learning as much as you can about where the field is and where we're going can really help empower you as a patient and your loved ones. So I'm going to start out first by talking a little bit about the natural history of melanoma to kind of give you a framework. And as a physician scientist, I think a lot about what's happening at the molecular level. And so I think it's helpful for patients to kind of have an idea too of what's going on. So in your normal skin, you have these wonderful little cells at the bottom called melanocytes. They are few and far between. Their job is to make melanin, these little dark granules that get sent out to all the cells in your skin. The job of those melanin granules is to sit almost like a little umbrella and parasol over the nuclei of your cells. And that job is to really protect those cells from DNA damage from the sun. For patients who have really, really light skin, their melanin granules are often a little fewer and far between, and they're lighter. For people with darker skin, they have a lot darker melanin and many more melanin granules that are protecting their cells. Now, what happens is when we get exposure from the sun, UV ends up coming down and can impact the DNA in these cells. And over time, our body should be repairing this DNA, but doesn't always do the best job and can't always do it perfectly. What can happen is many of you know and have seen you can get moles, and these are just several melanocytes that have started getting a mutation and they start growing, but for the most part are behaving themselves. But over time, with more mutations, this can turn into a melanoma. And so, this is something where these melanocytes are no longer behaving. They're continuing to grow and expand. They're destroying the skin around it. And if given enough time and with certain invasive types of melanoma, those cells can even get into your blood or your lymphatics and spread to other places where they set up shop and grow and ultimately are much harder to treat. So there's many things as patients and as physicians along this whole trajectory that we can do to sort of try to take what's in our control to help improve outcomes and the way that we manage this disease. And the way that I put these in sort of 5 different buckets, and they kind of go along this spectrum, I think it's important for all of us to understand what is our susceptibility, first of all, to melanoma and skin cancer. How can we protect ourselves from the sun so we can minimize the UV damage that predisposes us to getting these melanomas? What should we do about surveillance? Many of us, we can't change the past, what our sun exposure is. How do we watch our skin? What should we be doing to look out for melanoma? If we do have melanoma and we get treatments, how do we manage the side effects of those? And then across the whole continuum, some of my recommendations that I think are important is really building a support network. So we'll go through those. But to start out, let's talk about susceptibility. So melanoma, it's important to know, can happen in anyone. It does not matter what your skin type is, but it is definitely more common in patients with fairer skin. So the lighter your skin, the lighter your eyes, red hair, blonde hair, the melanoma is much more common in patients with those skin types. On the other extreme, patients with darker skin are still at risk for melanoma, and their melanomas often occur on areas where skin is lighter or maybe not even so pigmented. So the palms and soles of the feet, even the genital areas, the mouth, places where the sun doesn't always shine are places that people still can get melanoma. Now, exposure history has big impacts on melanoma risk. So when I'm talking to patients, we think a lot about how much time have you spent near the equator or places where there's a lot of UV sun? Have you had a history of using tanning beds? Have you had any outdoor occupations, roofing, farming, lifeguard? Do you have a lot of outdoor hobbies, spending time at the lake or the beach? And importantly, how many sunburns have you had? Do you have a history of a lot of times where you've got blisters or peeling? Those are all things that put you at a higher risk of developing melanoma. In addition to exposures, everyone has kind of clues in their personal history that can also influence their risk. So patients that have had an organ transplant or have other reasons why their immune system might be low or at a higher risk of developing melanoma, patients that have many moles, more than 30, 40, 50 moles, we know are at a higher risk. When those moles are atypical and have kind of unusual shapes and sizes, those patients are more likely to get melanoma. And of course, if you've made one melanoma, it is very possible you will make another. Now, while the majority of melanomas we think come from our sun exposure and our risks, there are a small percentage of melanomas that are a result of what we would call kind of cancer genetics or family genetics. These are important questions to kind of think about for yourself and also talk about with your doctor. So we like to know how many of your close relatives have had melanoma, and close relatives being usually parents, siblings, children, and kind of the next step after that, grandparents, aunts, and uncles. How many have had pancreatic cancer? So there are some genes where melanoma and pancreatic cancer go together. That's another question we want to know. And then how many close relatives have had other cancers? We often talk about the rules of threes, which is if you've had 3 melanomas, if you've had 2 and your parent had a melanoma, we start thinking about whether you maybe need to get seen by cancer genetics, or if you're someone that's in a very low risk group, so someone very young or someone with a lot of pigmentation and you have 2 melanomas or someone in your family does, we think about cancer genetics. Now, there's a number of genes. Many of you have heard about BRCA1 or BRCA2 with breast cancer. There's a number of genes we now know are related to melanoma. Why does this matter? If we find out that you or your family member has one of these genes, it impacts the frequency in which we want to screen you, and it also impacts whether you need to be screened for other types of cancers. So in terms of susceptibility, my 3 to-do list tasks for you are to review your skin type and exposure history, your family history, know what kind of risks you come to the table with, modify the risk factors you can, which we'll talk about with sun exposure. There's many things we can't change. And if melanoma or other cancers run in your family, I encourage you to talk with your dermatologist about potentially meeting with a cancer geneticist. Okay, so moving on to sun protection. This is something I spend a lot of time talking about with patients. My first piece of advice is to really be aware of the UV index. UV index is how strong those UV rays are that are coming and hitting your skin. UV index is impacted by a lot of things, especially latitude. If you're down near the equator, that sun is blazing. Altitude, so how high are you up? If you're up on a mountaintop, you're going to get a lot more UV. The season, the time of day, clouds, pollution, ground reflection. These are all things to really keep in mind as you're going outside and spending time. Ideally, avoid that peak day sun if you can, and then you really need to be thinking about how much you need to protect yourself in the context of the UV index. I encourage my patients when we talk about protecting themselves from the sun to really use a layered approach. Okay, so everyone, hears a lot about sunscreen. Sunscreen's great. Some of my recommendations are you want an SPF of at least 30 or 40. It needs to be broad spectrum. If you're outside sweating or on the water, it needs to be a water resistant, applying every 90 minutes. There's a variety of sunscreen types, including tinted ones. If you don't like that kind of white pasty look, there's plenty of tinted ones now that help with that. It's important you apply it properly. You need to use enough of it. And I always say the best one is the one you will use. So you really have to take time and find one that, doesn't bother you. Now, sunscreen is amazing, but I really think it is not the workhorse of what we use to protect our skin. Clothing is amazing, and now UPF clothing from what it was 10 years ago has improved so much. There are great UPF clothes. They get rated sort of like an SPF. So UPF of more than 50 is very protective. It's doing, in my opinion, a better job the sunscreen because you don't have to worry about constantly reapplying. Did you miss a spot? And like I said, many of them now are a lot lighter and cooling and work great. In addition, you should be thinking about hats, covering your ears, scarves, sleeves. If you play golf, I have a lot of golfer patients. Those sleeves are UV protectant and work great, sunglasses, and then don't underestimate the shade. Whenever I am out, I love being outside. Whenever I'm outside, I'm also always seeking where is that spot that I can go where it's cooler and I'm also not getting as much sun. So my overall recommendations in terms of sun protection, be mindful of the UV index, take a layered approach, and then really I encourage people invest in some products up front. Just decide I'm going to spend a little bit more money. I'm going to buy 4 or 5 different sunscreens. I'm going to buy a couple of these different shirts, figure out what I like, and that's really an investment going forward. Okay, so surveillance. So your skin history and sun exposure history is what it is. Some of you may have moles, some of you may have a history of melanoma. What do we do in terms of monitoring our skin? So it's important everyone has a surveillance strategy. I consider surveillance strategy falling under 2 arms. One is what you do yourself to watch your skin, and the other is what you need to do in terms of getting a professional to help you. So what you can do yourself, we do recommend in terms of skin checks that you try to look at your skin once a month. Many of you have probably heard about the ABCDE rules. You can find this at the AIM at Melanoma website. These are kind of the things to look out for. We also have some other rules that are a little bit less known. We call it the ugly duckling rule. So if you see a spot on your skin that doesn't look like any other spot on your skin, you need to bring that up with your dermatologist. The non-healing rule, if you have what you think is a pimple or a sore that just will not go away, that's another warning sign that you should have it looked at. I put on here, make sure you look where the sun doesn't shine, because melanoma can happen anywhere, and you really need to know your body and recognize if something is new or doesn't seem like it belongs there. I always encourage patients to what I call high alert zones. So areas on your body where you have had a melanoma, where you have a scar from your melanoma, that whole vicinity we know is a little bit at a higher risk of getting a new melanoma. So keep a close eye on that. And then of course, lymph nodes in those areas. If you aren't sure about a spot, I tell a lot of my patients this because, this is a lot to be looking at your skin and monitoring. If you have something that catches your eye, take a photo of it. We have amazing, smartphones now. Take a good, clear photo and keep an eye on it and look over the course of weeks to a month and see if it's changing. And last and most important, if you're not sure, contact your doctor. It's not your job to be able to know whether something is a melanoma or not. We just want you kind of being on the lookout. Now, when it comes to professional screening, I would encourage you to seek out a board-certified dermatologist. These are people who go to school for many years. I can attest to that and see lots and lots and lots of patients in their skin. If you're high risk, and high risk being someone that has one of those cancer mutations that we talked about, if you have a history of having melanoma or many, many atypical moles, I would say consider seeing someone specialized in pigmented lesions or melanoma. The guidelines are rapidly changing. You want to ensure you have a doctor that is accessible to you. Okay, it's very, very hard right now in healthcare. Wait times are very, very long. The system can be clogged. And for someone that has a spot that's concerning to them, we don't want that sitting on you for months and months. So find a doctor that can get you in and is willing to see you quickly. And then work with your dermatologist to determine how frequently you need to be seen, once a year or more often. When I do skin checks on patients, I use that tool that's right up there often. It allows me to be able to kind of magnify and look at a mole very close and have a better sense of whether it may be concerning or not. And we often use things like photography and mole mapping as well. So in terms of developing your surveillance strategy, my recommendations are get familiar with all your skin, monitor it monthly. If you're unsure about a spot, take a photo and watch it, and then identify and meet with a dermatologist for skin checks at regular intervals. All right, side effects. So there are side effects related to all the things along the spectrum, and we're going to briefly go through those. So first, some patients develop sunscreen allergies. I'm telling you to protect yourself from the sun. I have patients that do such a good job and unfortunately sometimes find that they're allergic to sunscreen. Commonly, this is fragrance that's in sunscreen, so I encourage you to use sunscreens that are fragrance-free. Sometimes it's the actual chemical sunscreen component. If you think you might have an allergy to sunscreen, the best ones to use are the ones that are physical sunscreens. So their active ingredient is titanium oxide, zinc oxide. You can find these in more of the infant children area often in addition to the adult sunscreen areas. Scars. So Dr. Dan's going to be talking to you about different surgical approaches to get rid of melanoma. Some patients are very prone to having keloids and hypertrophic scars. Because melanoma scars can sometimes be long, these can be, really bothersome to patients. We have tools in the clinic to be able to treat these scars to try to minimize the symptoms associated with them and make them not quite so large. Radiation, for patients that are receiving radiation, sometimes the skin can be affected by this. Your dermatologist has several tricks in their toolbox to help kind of really improve this and make this more manageable. Some of it is the tincture of thyme. And as patients now, so many new therapies have come in for treating advanced melanoma and systemic melanoma, and many of these have side effects. So patients that are on BRAF or MEK inhibitors, we know have a variety of skin side effects. Some of these can be sort of acne-type lesions. Sometimes it's changing of moles. Some people develop actually a different type of skin cancer while they're on these medications, and so making it even more important that you see a dermatologist and that's helping watch out for these. For patients on immunotherapy, so patients receiving these various infusions, these boost your immune system. It's great when your immune system is working against that cancer, but a lot of times it also starts working against other things. So one of those, the most common in melanoma patients getting treated with immunotherapy is vitiligo. This is where your body in the process of fighting the melanoma cells sometimes gets a little bit confused and starts fighting the normal melanocytes in your skin, and that can leave these white patches. The good news is that we do know people that develop that. It often means the immunotherapy is doing its job and your immune system is working well. Other things that are very common on immunotherapy, lots of patients I see with just dry skin, itchy skin, and immunotherapy rashes can really be any type of skin issue like psoriasis, eczema. Most of the time are not super severe, but it's important you get seen early so we can take care of things. Now, this I put on here, this is not a side effect of treatment, but it is something that I like patients to be aware of. A lot of my patients who are on immunotherapy are under the assumption that because they're on immunotherapy, they wouldn't be developing a new melanoma. But the data shows that's not entirely true. So about 5% of patients that are on systemic immunotherapy for a melanoma that's inside of them can develop a new melanoma on their skin. So it's important that even though you're undergoing these treatments, you still see a dermatologist to look out for new spots. We don't want you to have to fight a second melanoma. So in summary, the to-do list for side effects: use products for sensitive skin, minimize fragrance or unnecessary products. If you develop a cutaneous side effect while you're on any of these melanoma treatments, contact your dermatologist early. It is way easier for me to help you with the problem at the beginning than after the cat's out of the bag. And then continue getting skin checks, even if you're receiving immunotherapy or systemic therapy. Okay, the last thing I just want to touch on is support. I think, having any kind of cancer diagnosis and can be a really a big struggle. And so I think, support is something that's super, super important. I talk to patients about this a lot. So the first message I'd like to tell you is to take care of you. So a cancer diagnosis is scary. You are taking the first step. You are empowering yourself with knowledge. I have this to-do list for you because I want you to think about the action items and the things that you can do. Importantly, do not be afraid to go outside. Okay, I have so many melanoma patients that begin to feel so concerned about UV and the sun that they no longer enjoy their hobbies. They don't go outside. Don't do that. Like you can still get outside, enjoy your life, spend time out in the sun. Just do the things that we talked about to protect yourself. It's really important to find medical professionals on your team. Like I said, it is not your job to be able to look at a spot and know whether it's a melanoma or not. That's my job. The reason why we have you come back for these skin checks is because, that's my job to find those spots on you. I just think it's a good idea for you at home to kind of also know if something's popping up and new. Choose a team that's knowledgeable, that knows the newest research and is accessible to you. Like I said, you need to have someone that you can get into the clinic, and you want to make sure they're on top of all the new things. And then consider getting involved with the melanoma community. It's such a special group of people. I'm always so inspired by my many patients. Consider volunteering. These things are also, I think, really good for our souls, to be around other people and supportive of one another. I would encourage you to think about donating to melanoma research efforts. There have been so many strides in this field over the last decade, and many of the things that we treat patients now did not exist when I was in medical school. cool. Consider participating in clinical trials, not just for you, but because providing these samples help researchers like us better understand the disease, and then really educate others. So I can't tell you how many patients come to my clinic and say, someone pointed this spot out to me. I was at the store and someone said I should have this looked at. My barber had this told me to have this looked at. And a lot of times that's how we catch melanoma. And so really be there to help educate other people. So in terms of your support network, take care of yourself. Don't let a melanoma diagnosis stop you from living your life. Partner with a board-certified dermatologist that you trust, and really consider getting involved with the melanoma community. This checklist is all the things that we talked about today. It will be available online in the video. I would encourage you to kind of go through it, make sure you're doing all the things that you need to take care of yourself or your loved ones. And then lastly, thank you so much for having us here today. If you need a dermatologist, we just recently opened a subspecialty dermatology clinic here at the Cancer Center at UT Southwestern. This dermatology clinic is specifically for patients that have melanoma, especially advanced melanomas and are undergoing treatments, and also patients that have various risk factor genes. And there's the phone number there if you need to call and get an appointment. I want to also thank AIM at Melanoma for hosting this, as well as I didn't talk about my research today, but the research that we do in melanoma in my lab and across the country and across the world couldn't be done without generous support from many foundations, as well as the National Institutes of Health. So thank you all, and we'll look forward to questions in a little bit. I'll pass it on to Dr. Dan.